Thanks for staying with us. Today marks World TB Day. There are calls for increased efforts to ensure early identification, treatment and prevention of TB, especially for people living with chronic diseases. TB remains a leading cause of severe illness and death among people with HIV. For more on this, we are joined now by Professor Tumbi Ndungu from the Africa Health Research Institute. Very good evening to you, Professor. Thank you for your time. The WHO has confirmed that TB cases are on the rise, not only in South Africa, but globally, which speaks to some serious concerns around TB.
Yeah, good evening, Paul, and good evening to the viewers. Yes, TB, as you mentioned, is the leading infectious killer worldwide, and unfortunately, 1.6 million people died from tuberculosis last year. That's in 2021 alone, and the numbers have been going up, unfortunately, and this is particularly during the COVID pandemic. At the height of the COVID pandemic, a lot of TB services for prevention as well as treatment were interrupted, and this has resulted in the number of cases going up. So TB is one of the most significant public health problems that we face in South Africa, but also globally. And it is particularly more severe in South Africa because of the fact that the majority of cases that we see in South Africa are HIV related.
Yeah, and speaking today in commemoration of World TB Day, we heard Deputy President Paul Mashatile saying that measures are in place to fast-track the implementation of TB recovery in order to eradicate the disease completely by the year 2030. What is it going to take?
I think it's going to be a very tall task to get rid of TB by the year 2030. It's a laudable goal, and I think that it is good to set that kind of goal. But given the current trend where the number of cases have been going up, it's very unlikely that we will be able to achieve that milestone of eliminating TB by 2030. The main problem that we have with TB is, in fact, has to do with diagnosis. The vast majority of people, particularly those living in low and middle income countries, such as South Africa, are in fact infected with TB or have had exposure to TB and have what we call latent TB. The problem with TB is that it is very difficult to diagnose TB, and especially to have early diagnosis of tuberculosis. So what tends to happen is that by the time somebody presents at the clinic with tuberculosis, they have been living with the condition for a while, and they have been probably spreading it to other individuals, either within the household or within where they work for a long time, because the signs can be subtle of tuberculosis. In fact, there may be some people, as some of our own recent research has shown, who might be shedding the bacterium, the TB bacterium, without reporting any symptoms. And therefore, I think one of the key goals should be to fast-track diagnosis and to improve the diagnosis of tuberculosis so that it can be diagnosed early and so that people can go on treatment. Because of course TB is treatable and it is actually preventable.
Yeah, it's treatable and preventable, but we know that health facilities have been struggling to locate patients who are diagnosed but who may be defaulting.
That's correct, Paul. And part of the problem is that the treatment for tuberculosis is a long. It requires long treatment, up to 6 months of treatment. WHO has recently released some guidelines that are beginning to be implemented now in low and middle income countries to try and shorten the treatment period for TB from 6 months to 4 months. So I think there are multiple ways in which we can approach this problem. One, of course, is to improve the diagnosis and to develop new diagnostic. And there is a lot of research going on to try and improve the diagnosis of tuberculosis so that it is easier and so that we can have more sensitive assays that can detect the infection early. But the other problem that we need to deal with is a long treatment regime, up to 6 months of treatment for somebody to be declared to be TB free. Now, this is too long for most people, particularly those in resource-limited settings, and therefore what tends to happen is that a lot of people default and are lost to follow-up, and they do not adhere to treatment, and this means that they continue to spread the bacterium. And I think we should also mention the development of an effective vaccine. The current vaccine that we have is a very old vaccine, and it is not effective, particularly in adults. It's only it can prevent childhood tuberculosis, but we definitely need to develop better vaccines that might be able to prevent particularly adult tuberculosis.
Mm-hmm. And looking at the trends that you make mention of, Professor, looking at how diagnosis is also a challenge, what is it that one can look at when doing a health check to try and establish whether or not you should be going in to have yourself tested?
I think in particular in South Africa, it's important to note that most of the TB cases that we see are linked to HIV infection. It doesn't mean that everybody who succumbs to TB is living with HIV. That is certainly not the case. You can get TB without HIV infection. But a lot of the cases that we see in South Africa, perhaps up to 70 to 80% of the cases are linked to tuberculosis. So particularly for people who are living with HIV, it's very important, the first thing, that they should be on antiretroviral treatment, because antiretroviral treatment prevents the progression of latent TB to active tuberculosis. But the other thing is to watch out for the 4 cardinal signs, 4 cardinal symptoms of tuberculosis, which include a fever, weight loss, unexplained weight loss, night sweats, and coughing. Those are the 4 cardinal signs. Now, as I mentioned, the problem is that there may be people who might also be shedding the bacterium without these signs. But in cases of people who are living with HIV, being on medication helps. Of course, going for regular checks, and in the case of any of these 4 cardinal signs of tuberculosis being present, one should definitely go for a medical checkup, as well as if there is any kind of household contact or work contact who develops tuberculosis. It is very important that one should go for testing so that we can prevent the spread of this killer disease.
Yeah, absolutely. Thank you so much, Professor Tumbi.